Hi everybody, and welcome to our YouTube channel. My name is Maria Williams, and we want you to be in the know. Today we want you to be in the know about original Medicare Part A. This is our How Medicare Works model that we created. And what the model shows is you have two basic options when you are eligible for Medicare. Option 1 is on the left-hand side with all the colors. Option 2 is on the right-hand side with the yellow. Today we're going to be talking about the option 1 side, Part A. So what does Part A cover? Part A covers your hospital insurance. So that's when you're an inpatient in the hospital. It also covers when you're in a skilled nursing facility. Put the definition of a skilled nursing facility to the right. You can read that. That's not custodial or long-term care. You'll have to find other ways to pay for that, like there's insurance you could get, or else you could get on Medicaid, state Medicaid to pay for that, but Medicare Part A does not cover custodial long-term care. It does, however, cover hospice care, that's end-of-life care, and some home health care. Now let's talk a little bit about the cost for Part A. When you're a Medicare beneficiary and you're first eligible for Medicare, typically you're not going to pay a monthly premium for Part A because you've already paid it. You've already paid it if you or your spouse worked 10 years, or the way Social Security Administration looks at it, 40 quarters, because there are 4 quarters in a year. If you've done that, you had the cost of Part A taken out of your Social Security taxes when you paid Social Security taxes. So that's a good thing. Now, what about if you haven't worked 40 quarters? Well, there will be a cost for Part A. So I put on the chart here, if it's at least 30 quarters, then it's $278 a month for 2023. If it's less than 30 quarters, it's $506 a month. So for those of you that have children or grandchildren, maybe they're not thinking about working a traditional job where they pay Social Security taxes, let them know to keep this in mind, that when it gets to the point where they're eligible for Medicare, then there may be a cost to them. Let's talk about some other cost. Let's say you actually have to use your Part A insurance and you're in the hospital. Then the day you go into the hospital, the deductible is $1,600. But it's not $1,600 per year, it's per benefit period. And each benefit period is 60 days. So for example, you go into the hospital in January, you pay the $1,600 off the bat. You stay in 3 days, it's only going to be $1,600. You go back into the hospital in August, you pay another $1,600. So it could be several benefit periods in a year. And then if you stay in the hospital for the 1 through 60 days, it's only the $1,600. But let's say you stay in the hospital a little longer. You're in there 61 days. Then it starts to add up. It's going to be $400 per day that you're going to have to pay. And once you reach the 91st day, it's $800 a day that you have to pay. And for skilled nursing facilities, the government will pay for you to be in a skilled nursing facilities for the first 20 days. But on the 21st day, it's $200 per day. So you can see how this could really start to add up if you have to use it. And you don't have any way to cover some of those costs or those gaps. You are now in the know about original Medicare Part A. Thank you so much for listening and watching. We look forward to seeing you on the next video.